Muscular Dystrophy, a male genetic neuromuscular disease by Christy West. What is muscular dystrophy? Muscular dystrophy is a group of hereditary diseases that affect the musculoskeletal system. As a result, it affects limb movement due to the weakening of muscles. Dystrophy means wasting away a particular part, organ, or tissue. Muscular dystrophy means wasting away muscle due to genetic makeup. Muscular dystrophy is caused by a mutation in the X-linked gene. Only males will be affected. This is an adult male with muscular dystrophy. Muscular dystrophy history and cause. There are 9 main types of muscular dystrophy, while more than 2 times as many related conditions to the disease. The most common type is Duchenne muscular dystrophy. Each type varies based on muscles affected, age, and rate of onset. Most forms affect about 1 in 3,600 males. Duchenne muscular dystrophy has a very rapid onset, while the other types are more slow progressing. The discovery of muscular dystrophy. The disease was first described by a Neapolitan physician, Giovanni Cimoloa, in 1834, and Gaetano Conti in 1836. However, DMD is named after a French neurologist, Guillaume Benjamin Ahmad Duchenne. In 1868, Duchenne was the first physician who did a biopsy to obtain tissue from a living patient for microscopic examination and diagnosis. Muscles. When the male starts to show signs, muscle tissues are replaced by fat, leaving the muscles weak. Proteins that are needed for normal muscle cells are mutated. The mutation results in not enough dystrophin, a protein in muscles. This is an important part of the muscle cell that provides structural stability. The recessive X-linked gene. There are more than 30 genes linked to different kinds of muscular dystrophy. The most affected gene is the X-linked gene. The X-linked gene that mutates is carried by females within the chromosomes that determine the sex of the child. Females are said to be carriers and show no signs of the disease, and many don't know that they are a carrier. Boys born to mothers with the gene have a 50-50 chance of being born with the disease. Males that do not develop the disease cannot pass on to his children. Daughters born to fathers with the mutations will be carriers. About 1/3 of all reported cases are spontaneous, meaning that there is no carrier in the family. Organs. While the disease mainly affects the muscle tissue, some organs are affected. The lungs, eyes, face, limbs, and central nervous system, including the heart and the brain. Males born with a heart defect may require the use of a pacemaker. Most often the brain is affected, causing developmental delays in learning, speech, and fine motor skills. Contractions of the hands will leave them within a claw-like state. The spine may become abnormally curved, causing scoliosis. The signs and symptoms. Muscular dystrophy is diagnosed based on signs, symptoms, and onset. Signs begin to show between 4 and 7 years of age. Parents report their observations like stumbling, falling, difficulty sitting and standing. When the affected male raises his arms, the shoulder begins to look like wings. Tongues and calves become pseudo-hypertrophy, or enlarging. Duchenne muscular dystrophy factors to be at least half of the reported cases. Progression from newborn to diagnosis. This is a male with Duchenne muscular dystrophy. Under 1 year old, you can see no signs. Between 2 to 3 years old, signs start to show. About 5 or 6 years old, this male was diagnosed. Treatment and prevention. Muscular dystrophy has no required treatment. Physical therapy is used to strengthen and tone remaining muscle mass. To control and help with the support of braces, appliances, wheelchairs, and orthopedic surgery. Prednisone has been used in some cases to keep the individual as independent as long as possible. None of these treatments will reverse the underlying pathology of muscular dystrophy, but will help improve the day-to-day life. Short and long-term outcomes. There are no short or long-term outcomes. Advances in medicine have prolonged life well into their 50s in some forms of muscular dystrophy. Recent advances in cardiac and respiratory care have made living with muscular dystrophy more manageable. Unfortunately, there is no cure for muscular dystrophy. References: the Cleveland Clinic Foundation, McGill's Medical Guide, Muscular Dystrophy Symptoms, Mayo Clinic, Muscular Dystrophy Association, Midline Plus Online Medical Encyclopedia, Muscular Dystrophy, Hope Through Research.